Hi, my name is Nate Lawson. I'm the Director of Biomaterials at the UAB School of Dentistry. My expert tip today is about cement selection for fixed restorations. So if you look at this recent practice-based research network study from 2019, what we showed was that if we look at the types of cements that dentists are using in the United States, the majority of dentists are using resin-modified glass ionomer for their fixed restoration. About 62% of the crowns were cemented with this, but 32% of the crowns were bonded with resin cements. When you look at lithium disilicate, most of them are bonded with resin cements, about 70% of those lithium disilicate restorations. And with zirconia, actually about 30% of zirconia restorations are bonded with resin cements. So when we think about resin cements, I think about them in two different flavors. We've got resin cements, which are self-adhesive resin cements, and then we have resin cements, which are used in combination with a bonding agent on the tooth. So in my mind, the difference between these types of cements are that I use a resin cement associated with a bonding agent when I need the most possible retention. So if I have something that's a very non-retentive preparation, like an onlay or like a tabletop onlay specifically, or a veneer, or something like a Maryland bridge, where I really need a lot of retention, I'll be using a bonding agent on the tooth structure associated with my resin cement. There are other times where I'll be using a resin cement, but maybe I don't need as much retention. So maybe it's just a lithium disilicate restoration that it's a millimeter thickness and I'm bonding it to get the additional strength. Or maybe it's a crown where I just think the preparation is a little bit less retentive than I wanted, and so I just want a little extra retention. In that case, I think I could get away with the self-adhesive resin cement. And the advantage of doing that is it's a little bit quicker restoration. That doesn't mean that you're being lazy. It just means that when you're using a resin cement, you have to have really great isolation. And if you don't think you can achieve that for as long, there's the advantage of using a self-adhesive resin cement. So I think that's the place for these two different types of resin cements. And one of the really interesting things that I've seen companies doing now is releasing resin cements that can be used either in a self-adhesive mode or used with a bonding agent. So an example of that would be like the cement Relax Universal from 3M. It's a cement that can be used with their bonding agent, Scotchbond Universal Plus, or it can be used in a self-adhesive mode. And we've tested this cement in our laboratory in both modes, and it performs extremely well in both modes. So I think that saves the clinician a little bit of time as far as inventory. It simplifies the procedure when we're communicating with our other staff in the office. And so I think it's a nice service to practicing clinicians. So that's my expert tip.